Tencon is a combination medication that is used specifically to treat tension headaches. It contains acetaminophen, which helps to reduce the pain associated with the headache, and butalbital, a sedative that helps to alleviate anxiety and promote relaxation and sleepiness. It is important to take Tencon as directed by your healthcare provider and to not exceed the recommended dosage. It is typically taken every 4 to 6 hours as needed for pain relief. It is best to take Tencon with a full glass of water to help with absorption. It is important to note that Tencon may cause drowsiness, so it is recommended to avoid driving or operating heavy machinery until you know how this medication affects you. Be sure to consult with your doctor for the best timing to take this medication. This medication is taken by mouth with or without food as directed by your doctor, usually every 4 hours as needed. The recommended maximum dosage is 300 mg of butalbital in a 24-hour period. The dosage is based on your medical condition and response to treatment. It works best if used at the first signs of a headache. If you wait until the headache has worsened, the medication may not work as well. If you suddenly stop using this medication, you may have withdrawal symptoms. Your doctor may lower your dose slowly to help prevent withdrawal. Withdrawal is more likely if you have used this medication for a long time or in high doses. Tell your doctor or pharmacist right away if you have withdrawal symptoms. While this medication helps many people, it may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Do not increase your dose, take it more often, or use it for a longer time than prescribed. Properly stop the medication when directed. Inform your doctor if you notice increased use of this medication, a worsening of headaches, an increase in the number of headaches, the medication not working as well, or use of this medication for more than 2 headache episodes a week. Your doctor may need to change your medication and/or add a separate medication to prevent the headaches. Some common side effects of Tencon include nausea, vomiting, abdominal pain, lightheadedness, dizziness, or drowsiness. To lower your risk of dizziness and lightheadedness, it is recommended to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, if you experience serious side effects such as shortness of breath, mental/mood changes, fainting, seizure, fast heartbeat, signs of infection, easy bruising/bleeding, or symptoms of a serious allergic reaction like rash, itching/swelling, severe dizziness, or trouble breathing, it is important to tell your doctor right away. If you notice any other effects not listed above, it is advised to contact your doctor or pharmacist. And as always, if you have any concerns about the side effects of Tencon, it is best to consult with your healthcare provider. Acetaminophen is an ingredient in Tencon. It's important to be cautious with the amount of acetaminophen you take, as taking too much can cause serious liver disease. Adults should not exceed 4,000 mg, 4 grams, of acetaminophen a day. If you have liver problems or are giving this medication to children, you should take less acetaminophen and consult your doctor or pharmacist for the safe dosage. It's essential to avoid taking any other medication containing acetaminophen without consulting your doctor or pharmacist first, as it is found in many over-the-counter and prescription medications. Always check the labels on your medications and ask your pharmacist if you are unsure about the acetaminophen content. If you accidentally take too much acetaminophen and experience symptoms such as nausea, vomiting, loss of appetite, stomach pain, extreme tiredness, yellowing of the skin or eyes, or dark urine, seek medical help immediately, even if you feel okay. Additionally, it's important to avoid daily alcohol use, especially when taking acetaminophen, as it can further damage your liver. Before taking Tencon, it is important to let your doctor or pharmacist know if you are allergic to acetaminophen or butalbital, other barbiturates, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, enzyme disorder, liver or kidney disease, history of substance use disorder, mental/mood disorders, or abdominal/intestinal problems. Tencon can make you dizzy or drowsy, and consuming alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or any activities that require alertness until you can do so safely. It's also recommended to avoid alcoholic beverages and to discuss marijuana use with your doctor. For older adults, they may be more sensitive to the side effects of Tencon, especially drowsiness, which can increase the risk of falling. During pregnancy, Tencon should only be used when clearly needed, and using it for long periods or in high doses near the expected delivery date is not recommended due to possible harm to the unborn baby. It's important to discuss the risks and benefits with your doctor. Infants born to mothers who have used Tencon for an extended time may experience withdrawal symptoms, so it's important to seek medical attention if any symptoms are noticed in the newborn. Tencon can pass into breast milk and could have undesirable effects on a nursing infant, so it's important to consult with your doctor before breastfeeding. It is important to be aware of potential drug interactions with Tencon. This medication can affect how other drugs work in your body, and may also speed up the removal of other drugs, which can impact their effectiveness. It is important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Some products that may interact with Tencon include darunavir, sodium oxybate, anti-seizure drugs, isoniazid, ketoconazole, levodocaconazole, phenothiazines, doxycycline, estrogen, blood thinners, certain beta blockers, corticosteroids, and others. Additionally, it is important to inform your doctor or pharmacist if you are taking other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. It is also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Furthermore, Tencon may decrease the effectiveness of hormonal birth control, so it is important to discuss with your doctor or pharmacist if you should use additional reliable birth control methods while using this medication. It may also interfere with certain lab tests, so it is important to inform lab personnel and your doctors that you are using this drug. If someone has taken too much Tencon and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222. In Canada, residents can call their provincial Poison Control Center. Symptoms of an overdose may include severe drowsiness, slow or shallow breathing, nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Do not share Tencon with others. For tension headaches, Tencon can be used in combination with massage, hot baths, and other relaxation methods. Consult your doctor or pharmacist for more details. While taking Tencon, your doctor may recommend lab and/or medical tests such as liver/kidney function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. Tencon is a medication used to treat high blood pressure, hypertension, and to prevent chest pain, angina. It works by relaxing blood vessels and increasing the supply of blood and oxygen to the heart while reducing its workload. Tencon is also used to prevent migraine headaches and to treat tremors and certain types of anxiety. It may also be used to treat other conditions as determined by your doctor. When it comes to storing Tencon, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of Tencon, make sure not to flush it down the toilet or pour it into a drain unless you have been specifically instructed to do so. Instead, properly dispose of the product when it reaches its expiration date or when it is no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.